I'd like to pass back to Ravi. I think there's been good activity in the chat while I've been speaking. I'm looking forward to hearing what people's views are about the prospective cluster.
Thank you very much, David, for the presentation. There's been, as you indicated, lots of questions asked. Some of these have been answered already, but I'll go through them as we go through them. First one is, Paddy asked about the opportunity for serious games in health and well-being, and I think, Ben, you did touch on that in terms of what you've been doing, and you gave some examples as well. So if there's anything else you want to add around that in terms of future proposals or anything coming out of COVID that might be an opportunity to develop games, software around that, so feel free to comment on that. Andrew Short from GBS LEP, who's asked a question to Mike. They're doing a space audit to see what space we have available in the life sciences sector, the health tech sector, and what's coming up. And you mentioned a health tech incubator. Could you send any information around that? So I will be sharing the slides with this, but if there's anything else that you'd like to add, Mike, please do, in terms of spaces for SMEs. Are you going to have the opportunity for SMEs to come and be hosted on the site as well? I did ask a question as well around connectivity. Do you know if there's 5G connectivity available at the campus there, Mike?
I don't, but I know a man who might, who's in the box below me at this moment in time. So I'm going to defer that to Andrew.
Thanks, Mike. So there isn't at the moment, but the centre is in the process of being constructed. So we've currently got a growth deal bid in with government around a 5G connected region throughout Staffordshire, so hitting particularly rural areas, not just the more urban ones at the same time. So we do anticipate that we will have 5G connectivity.
Fantastic. That sounds quite exciting. And so, question from Paddy. Mike, is the plan to bring companies into the building as well?
I think that's exactly the kind of conversations we're having at this moment in time within the university, evaluating what the space can offer and what other space we've got to offer. But the concept of using the Centre for Health Innovation as an entity for people to sit within, whether that be to think about the research and development aspects or other aspects of providing test bed facilities and those kind of things, that's exactly what we're shaping at this moment in time. I'm very interested to have conversations with any colleagues about ideas they've got around that.
Fantastic, and I think that joins into what Amy Farrington said, who's mentioned that there is a science park at Kiel if there's any space capacity issues. So those are the questions from the chat function. So the floor is open to anybody now who wants to make comments or any of the presentations that you've heard today, and please do raise any questions that come to mind. Paddy, you've got your hand up.
I didn't mean to have my hand up, to be honest. No, I don't have a particular question. Mine have been answered. Thank you.
Okay.
Let me take that down.
Chris Crozier, please.
Great, thank you, and thank you so much for the presentations. If we think that our careers are set out by leadership moments, and David reminded me of my technological failures when we last met, I seem the most unlikely candidate to be present at this session today. But thank you for bearing with me on that. So I guess one of the things that strikes me for many of us who connect through the West Midlands on lots of different innovations, and also, you know, where we are geographically, sitting on very many boundaries geographically, the North West Midlands is often feeling a little bit perhaps overlooked in terms of strategy and development when the West Midlands as a whole is represented. So I think it's very exciting to know that this is not the case with this particular initiative, and the North West Midlands is very much present in that. So one of my questions is that in terms of universities, would you be looking for offers that would be equivalent to a membership fee? So one of the things I can think of straight away currently at the moment the Impact Accelerator unit that I'm in has a scheme called Business Bridge, which is for businesses in Staffordshire, small and medium-sized enterprises, and they can come and get an offer of a small amount of funding or additional support from people at Keel to help them think through their next steps with their SME. And Amy can pick this up if I'm not describing it very coherently. And that comes through an existing current funding model that does come to Keel to do that piece of work. So is that the sort of thing that it would kind of work both ways? And it's just one example from Keel, but it would work both ways, because Business Bridge would be unlocking the opportunity to network with lots of businesses and support them. And hopefully the businesses who seek that support do benefit as well in some way. So that's just kind of one example. Is that a model, or are you very certain that you want a kind of a bottom line funded membership commitment from a university?
Shall I respond to that one, Ravi?
Please do.
Okay, so thank you very much for that question, Chris, about the funding model. I mean, just first of all, I saw Amy's comment about the science park at Keel, and of course it's one that I know very, very well. I first visited it when it was still under construction. That's how long I've kind of been associated with the university. And I'm a classic FM listener, and I've heard a lot of adverts lately for the science park at Keel University, so it's still in my mind. I take your point about the geographic distance from the Birmingham part of the region in North Staffordshire, and I do see from my own inquiries and discussions in the last 6 months how that distance can turn to forgetfulness, and as you see from this roadshow, I'm determined that this won't happen with ourselves. And one of the successes of the roadshows is that people like this format, and we've said that we'll continue doing these as a cluster organisation going forward. And so I'll be back, and I'll be at Keel University for one of them, without a doubt, in the future. But turning to the funding model, I think it is important that we're going to be a business-led organisation, and we're going to be focused on our businesses who are members paying for our services. What that doesn't mean is that we'll have our eyes closed to opportunities to attract funding into the region and into the sector. In fact, I would like to think that in the end, people who've got money to give out as grants or to lend out as investments would find us one of their ports of call when they want to know what are the best activities that they should be investing in or funding in the West Midlands, and we'd be in the know. We'd be able to make introductions, and we'd be able to recommend the best value for money use of their money. So I'm very much looking out for the region's technology sector, health technology sector, in securing funding and more funding for the West Midlands, more funding being where the advocacy role comes in. But in terms of universities joining with the cluster, yes, I would like all the region's universities to join the cluster as a member, that's for sure. So I'd like everybody to be a member, to be networked with us, to have access to all of our meetings and networking opportunities, just like every business member that joins too. But I'm also interested in talking to universities about that strategic partnership role. In the end, the number of strategic partnerships in total will be limited, of course. So it's better to be early if you've got an idea about this. But if there were a university that wanted to adopt a particular theme of activity that fits with what we're planning to do as an organisation, we would talk to the university about a strategic partnership with them. And some of the cost of being a strategic partner would be handing over some money, and some would be handing over some in-kind support for the activities in that theme. So I would envisage we would have a year's calendar of programs programme of events that the cluster is promoting. It would be broken down into individual themes, and where we have a strategic partner with us on a theme, everything would be jointly badged between us and our strategic partner. So I do invite you to think about universities being strategic partners with us, or even a pair of universities as a strategic partner. And just the same as we're talking to other kinds of businesses, I'm talking to universities about that. I hope that's helpful.
Thank you, David. Any more questions? And I must say, Amy, I have been out to the science park at Keele. Actually, it's quite impressive, and I met with Rosie Monkman there. My understanding is the Business Bridge is ERDF funded. So
yeah, Business Bridge is ERDF funded, and that's just one of the schemes that we've got. We've obviously got a number of schemes, and yeah, we've got a great science park and still growing. Building new buildings, and so yeah, lots of capacity.
And that scheme was open to all businesses across Staffordshire as well, so it's quite a large scheme for across the region.
Yeah, yeah.
Any more questions on presentations or information that we've heard today?
I think, David, I think it's one of the things that we talked about when we met was, where do you see this cluster fitting in with the other cluster organisations and membership organisations we've got throughout the region? And certainly we've just been looking at budgets, and I've been given a big list of organisations that we're members of, and I'm going through my annual kind of justification for each of those kind of membership groups. So I think it's important where we see the differentiation between this, and I think it's great, and I love the way you're talking about bringing in the North West Midlands. As we say, we talked about often feeling kind of left out of some of the other, through geography, and that might for us be the key to this particular cluster. But I think that it is something that does need to be addressed. Medilink in particular is the obvious analogy to the cluster and the model that you've proposed, and just trying to understand how what the offer is and how it's differentiated.
Yeah. Okay. There are three aspects of what you've just asked me that I want to deal with. The first one is again about that geographic distance from the Birmingham that a lot of people focus their attention on when they talk about the West Midlands. And we want to demonstrate that we are going to overcome that hurdle partly through the composition of our board, so that it's representative of the region, and partly through our engagement strategy, which will include, as I say, continuing the roadshow approach around the region as part of what we do. And how we consult with our members will be very much kind of biased towards our members, so that everybody gets their say wherever they are in the region. So that's the first thing. I think Medilink is a particular example of where people raise an eyebrow about our being established, because Medilink is already in some of this area and already has a member-based organisation. And I've had several conversations with Medilink, because I definitely don't want to tread on their toes, and I definitely want to add value, not detract value from what they already do. So where they have contracts for services, as I've mentioned in my presentation, we're not at all going anywhere near that. That's for them to continue with. But where they've got members and we're going to have members, my ideal, but this is only a in principle conversation at the moment, would be that we could join up our memberships and offer the benefits of both organisations to both organisations' membership, and sort out the sharing of the costs of that internally between the two organisations. So that's my ambition for that one. But the other networks that proliferate, we've got the Academic Health Science Network, we've got the LEPs across the region, we've got growth hubs in some of the LEPs, we've got a growth company to attract inward investment, we've got the local authorities with their economic development hat on. So there are a lot of organisations. And something we've hit on quite recently that I'm very attracted to is something called a concierge service, where when people ask, I've got a problem, how do I solve it? If they come to ourselves, or if they come to one of the members of the concierge service, we all have the same protocol for dealing with their inquiry. And we all ensure that with the buck stopping with the cluster, we all ensure that that problem is solved to the satisfaction of the inquirer, and nobody lets go of the person until they say that they're satisfied at the end of the process. So we're working up an idea called a concierge service at the moment, which I think is something that both is distinctive to the West Midlands region, and will be a way of overcoming that lack of coherence in the past and bringing us all together on the same idea, the concierge service that we all support, and we all know what its systems are and what its protocols will be for how it operates. So that's my answer to the wider set of confusions, and the Medilink one is a particular one, and I've explained how I'm trying to deal with that one individually.
Thank you, David. I think Sarah Jane had her hand up, which will probably be the last question before we hand over to Andrew to close.
Yeah, thanks. I guess it was really a little bit like what Amy said about all these other organisations. I'm thinking about Birmingham Health Partners, the Medical Technology Device Testing Centre that's run out of the Institute of Translational Medicine. Do we run the risk of having a West Midlands brand that basically is the ring around Birmingham as our kind of collaborative partner and membership, and potentially excluding because there's competing organisations in those areas working already?
Okay, and I can quickly answer this one, because I mean we have all those arrangements already, and if the cluster doesn't exist, they'll all still exist, and they're all quite strongly like a magnet attracted around Birmingham, and they're shaped around Birmingham, and some of them are great assets to the region as a whole, and we mustn't we mustn't minimize that in our considerations within the region, that perhaps we're not as coherent as we are. We don't want to wash our dirty linen outside in public, but they are strengths, but they are focused around Birmingham, and they do sometimes overlook the strengths that there are in the rest of the region. Where I think the cluster brings strength is that we've got that appreciation. We're going to empower the businesses themselves who use those services or have things done to them by those services around the region to be able to have a greater say and a greater involvement in those organisations too. And how they deliver their services will maybe change in the future because of that. So I'm hoping that we strengthen links across the region because we have the cluster.
Excellent, David. And I might be able to add a little example. One of the projects I was involved in the last couple of years was bidding for the West Midlands 5G programme. And we did that collectively through the Combined Authority, and we were successful in that respect. And I saw similar activity when it came for bidding for Channel 4 to be hosted outside of London. And there were numerous bids that came in from the West Midlands. And as you know, we weren't successful in winning that. So there's obviously strength in coming together and collaborating, and the proposed cluster obviously could be a home for that as well, because we'll be representing the whole of the West Midlands. We're down to the last couple of minutes. Andrew, over to yourself too for any concluding remarks.
Thanks. So yeah, just mindful of everybody's time, so I'll keep it brief, but it was just a big thank you from me for the opportunity to talk about some of the things that we're doing and to be involved with the tech cluster itself. Thank you for everybody for attending and listening to our story. And I guess the way I would sum it up is the ask from me is for people to view the Health-Tec cluster and indeed also the Centre for Health Innovation as a platform, because one of the things that I'm mindful of is that buildings, facilities on their own don't drive innovation and interesting activities. It's the combination of infrastructure, human capital, funding, collaboration. And I think these things are brought together via platforms. And I think that's what we're here today talking about and trying to offer, and hopefully get people excited about and involved in. So that's all I wanted to say. But do get in touch with either David or me or any of the presenters if you'd like any further conversations, and hopefully we can do some exciting things. So thank you.